Hey everyone, in today's video, I'm going to be interviewing the author of this book, Shoulder Pain, The Solution and Prevention, the exercise that heals the shoulder and relieves back pain. This is the 5th edition from the author, John Kirsch, MD, Dr. John M. Kirsch, MD. And I have him here with us today on this video. He is a retired orthopedic surgeon, has been in surgery for decades. He'll tell you more and more about himself, but I'm especially excited to interview him because I just picked up this book a few months ago, dove into it, and I'm just blown away. And I feel like I'm meeting a celebrity here, reading somebody who's just forward thinking in this topic. So I'm excited to bring them to you guys. If you have any questions, please drop them in the comments down in this video. I'm sure you're going to have plenty of questions. But let's see how many we can get answered from the man himself. So everybody, please welcome Dr. John M. Kirsch. Hey, Dr. Kirsch, thanks for coming on with us today. How are you?
Excellent, excellent.
I appreciate your time and
you.
Joining us. And where about are you in the country?
I live in central Wisconsin, Stevens Point, a nice community.
How close is that to where the Packers are in Green Bay?
Oh, we're south and west of Green Bay. Yeah.
Okay.
We're north of Madison, about 100 miles.
Oh, fantastic. I bet you guys get some beautiful weather in the summers up there. I don't know about the winters, but the summers are probably pretty good.
Yeah, it's a beautiful nature preserve here. It's nice. We live on the river, Wisconsin River.
Oh, beautiful. That's what we lack here. I'm in the desert in West Texas, El Paso, Texas. Beautiful mountains, but not a whole lot of water, but we love the mountains out here.
Yeah.
Well, I'm excited to talk with you about your book today. I've got it right here, Shoulder Pain. I've gone through the whole thing, and it's just phenomenal. So I've got plenty of questions, but before we get going there, what got you into surgery first off? How did you end up becoming a physician and then a surgeon? Give us a little background on yourself.
Well, I pretty much knew I was going to be a doctor from the time I finished high school, and then I went on to medical school, and here I am, an orthopedic surgeon after 50 years. The most important feature that I need to talk to you about the book is one single dynamic that for which I wrote the book. All right. I discovered something about the shoulder that no previous surgeon or investigator had published or discussed. But I found out that one simple exercise cures over 90% of shoulder pain problems. The most commonly operated shoulder problem throughout the world is called a subacromial decompression. The surgery for this problem, subacromial impingement, is done in England. For instance, the National Health Service in England pays 30 million pounds a year to have this surgery done. It's worse in it's even worse than that in the United States. Studies have shown that the overwhelming majority of these surgeries are unnecessary because the problem, subacromial impingement, is usually satisfactorily healed with nothing more than exercise. So physical therapy can help this, but the most important exercise that I discovered is hanging by your hands, hanging from an overhead support or bar. All right. I discovered this when I was having shoulder trouble, and the way that I found this out was I was hiking with my boys in a park, They got on a overhead horizontal ladder, and they went across the horizontal ladder like little monkeys. So I followed them and I tried to do this, and I reached for the first rung on the ladder, and I couldn't hang on. I had terrible pain. So I thought about that for many, many months, probably a couple of years. And then I went to study in Louisville, Kentucky, and I realized that I was having shoulder pain, so I started hanging from doors and other objects. And I found that I cured the problem by hanging. So several years later, I had the opportunity to do CT scans of the shoulder. And it is because of that that I was able to write the book, because I had to see the shoulder in the format of a CT scan to see if I was correct or not. I have a model that I'd like to show you.
Oh, wonderful.
Can you see this?
Looks great.
Okay. So this is what your shoulder normally looks like. That's from the front. And from the back, like this. Now, when you hang, you raise your arm like this. Okay. Now you're hanging.
Yep, I see it.
You see that?
The ball hits the acromion, and just so that, because our viewers may not be familiar with the anatomy and the conditions that you're talking about,
Okay.
the acromion is that part that has that red lining on it. Could you point to it, Dr. Kirsch, the acromion?
Yes.
That's
Yes.
gonna fall down. Yeah, right there.
This is the acromion.
Yep. And then the ball part of the joint is the end of the shoulder bone. So it'd be like,
Okay,
right
the
area.
acromion lies over the top of the humerus.
Yeah, it's part of the shoulder blade.
This is the humeral head here.
The ball part of the socket joint.
And the acromion overlies that. Okay.
Yep.
And there's a lot of muscles and ligaments that attach to the acromion that allow you to lift your arm.
Mm-hmm.
Like so.
And the condition that you mentioned that's most operated on is subacromial impingement. So that acromion, the space right under where the ball hits that acromion, that the theory is that gets pinched, and the tissues there, the rotator cuff tendon, the bursa, the subacromial bursa, and so when they do a subacromial, oh my gosh, the surgery slipped my mind, the decompression surgery. What exactly is being done to that area, Dr. Kirsch?
Okay. All right. This is the anatomy when you're hanging. Okay. And when you hang, this side of the humerus leans on the acromion, and there is a space in there that I call the acromiohumeral joint. All right. That's the space between the acromion and the humerus. And when you hang, the humerus bends the acromion. It bends it like that.
Yep.
All right. Now, if you go through life, everyday activities, your arm is hanging. The arm weighs about 10 pounds. And gradually it pulls the acromion down, and the acromion becomes hooked and curved, and starts to impinge on the humerus here.
Yep.
I'll point it out. Okay. This is the humeral head. This is the acromion. And so the dynamic that we're talking about here is what happens when you hang like this.
So the arm bone, the humerus,
Yes.
pushes the acromion and the coracoacromial ligament and stretches it out essentially and moves, reshapes, if you will, the acromion and the ligament.
Yes. Okay. That's probably the best.
That's a good view. Perfect.
There you go.
Yep.
Okay. Now the space here, space between the acromion and the humerus is the acromio-humeral joint.
Yep.
And I named that. It's never been previously discussed.
Yep.
That's the joint that allows the humerus to bend the acromion and relieve the impingement. And over 90% of people that do the hanging exercise cure their subacromial impingement.
Yeah. Phenomenal thinking, by the way.
I've got over 1,000 testimonials on Amazon, and over 90% of those are 4 or 5 plus stars.
Yeah, it's incredible. And just to show you some glimpses from the book for those of you watching online, those are
there you go.
Yeah. That he's talking about of the subacromial joint. And
it's easier for me to show that to you in the book.
Right there. Yep. And so if you want to get the book, by the way, which I highly suggest, there's a link in the description below to get yourself that book from Amazon. And it's not a super thick or complicated book. It really is written well. And there's tons of pictures just to show you how exactly what Dr. Kirsch is showing you right now, how that the arm bone, the humerus, bends the acromion. And it's revolutionary thinking, in my opinion.
Yeah. Well, it is. And yet the orthopedic surgeons in the United States, in Great Britain, in Australia, and Finland, and Sweden, and Germany, they still do subacromial decompression surgery as the treatment of choice for this problem. So I wrote the book for the public to try to help people understand that they don't have to have surgery for this problem.
Yeah.
All the time. Now, there are some instances where people need to have surgery.
Absolutely. I've got a couple questions from the book, and I think so. Two. One is about how exactly to do the hanging technique. But before we get there, I want to know about the Kauai study that you mentioned in the book here. So it was pretty incredible. You said that you had over 90 participants with a variety of shoulder problems, impingement, rotator cuff problems, and osteoarthritis of the glenohumeral joint or the shoulder joint, the ball and socket. And they nearly all got better doing the hanging technique. Now,
I had 92 patients that I followed who, after doing the hanging exercise for a period of time, cured themselves. One instance, there was an 83-year-old woman. I examined her in a doctor's office, and she was scheduled for a shoulder replacement in 1 week. But I made a special trip to visit her to this doctor's office. When I examined her, I raised her arm and she had exquisite pain. And I realized she had nothing more than subacromial impingement. So I recommended the hanging exercise to her, which she followed. And In 1 year, she was cross-country skiing. She did not have surgery. She had no more pain. Or that's probably the best example of one single patient. 83-year-old woman who was scheduled to have her shoulder replaced in Madison, Wisconsin. So over the years, there are literally hundreds of people who have had the same experience. And using the hanging exercise solved the problem.
That's incredible. Well, I have since purchased a pull-up bar for the clinic. I'm still waiting for it to be delivered. It's on back order right now, the one that I wanted. But I put some links down in the description for pull-up bars that you can get as well off Amazon.
Yes.
And I think it's phenomenal. I have yet to see to give you my full transparency. And for those of you that follow me on YouTube, stay tuned. I'm going to give you updates as they come. I've been recommending this to my patients over the past couple of weeks because just the idea is so revolutionary. I have no doubt it's going to work and improve. Just today, in fact, I had a gentleman who I've seen in the past for a rotator cuff tear, which he got better naturally without any surgery. I did the type of treatment that I do, working on certain joints and muscles.
Yes.
And I recommended him the hanging technique because he came in today with a lot of stiffness that looks like pre-arthritis. And so I'm hopeful that he's going to get more range of motion. He picked up his arms and his left just doesn't come up as good as his right does. So we'll see how this goes. I'm going to make videos here on YouTube pretty soon, probably involving the hanging. I want to see how it goes, but I wanted to hear from you. What do you recommend is a good protocol or a starting point for the hanging exercise to help out with shoulder pain problems?
Well, I recommend that people get the book from Amazon. It's only $10 or about that. And read the testimonials in the book. And also go to Amazon and look at the book reviews or testimonials there. There's over 1,000. And spend some serious time reading those. And you will realize that most people are able to solve the shoulder pain problems by doing the hanging exercise. You can get a simple hanging bar from almost any big box store. And they have hanging bars you can put in a doorway. And in most cases, even using what I call partial weight hanging, solve the problem. The best hanging is with an overhead bar that's high enough that you can have your feet off the ground.
Yeah, I love how you recommended it. And even in the book here, you have examples of hanging bars that you can use, ones that you can attach to the ceiling, the ones that go in the doorways right here, even these devices to help with grip if you're having trouble with your grip.
Right.
And then even a do-it-yourself version that people can make, the people that are handy with pipes. I thought that was very clever. The guy that came in today, I showed him this side of the book, and he said, "I'm going to do that." He works with welding and metal anyway, so it seemed very easy for him. And then the other recommendation that you wrote in the book about hanging, because I can already see people listening to this video and saying, "There is no way I can hang because I'm so heavy or I'm so weak in my hands." But I love that you said, put a step stool under, take some of the weight off, and just hang there without your full body weight. So that makes it a lot easier. What times do you recommend as far as like how long to hang, and what dosage, if you will, do you recommend for hanging?
Well, I recommend that at first people do partial weight hanging and keeping their feet on the floor. I had one woman who wrote a long testimonial that's in the book. She all she could do was to stand in her bathtub and hang from the shower bar, the shower curtain bar. And she couldn't put all her weight on it, obviously, but she made that effort to put her arm, raise her arms and put some weight on it. And in a matter of a few days, she was better. And over a period of 6 months to a year, she was able to go kiteboarding and wakeboarding and water skiing and did everything she wanted to do.
It's incredible.
So at first a person should be using partial weight hanging. You keep your feet on a stool and put some of your weight, or keep your feet on the floor and allow some of your weight.
Mm-hmm. Yeah, I agree. That's the best way to go because you need to build up your grip strength, and
Yes.
then your tissues in your shoulder need to get used to it. Obviously, you're essentially remolding your joint, the acromion specifically, so that you can tolerate it better. What are some expectations you can give the viewers about how long this will take? Because I can see some people running into pain for maybe even weeks or months and still trying to do it. And at what point should they maybe go talk to a doctor about it because it may not be effective for them?
Well, I recommend that everybody who has serious amount of shoulder pain should probably see a physician. But going right along with that, you cannot injure your shoulder by doing the partial weight hanging. So you might want to try that as well. If the pain continues for over 2 weeks, you certainly ought to see a physician. In the book, I say that, yes, you should see your physician, but I wrote the book, and it's a matter of the fact that you can take my advice, but you should see your own doctor. Yeah.
I get what you're saying. You're trying to say I'm a doctor, I'm giving you this advice, but at the same time, your individual situation might require an examination and understanding of what's going on.
Well, in the book, I say you may want to take the advice of your own physician.
Mm-hmm.
You can read the book.
Yeah, definitely.
There's no other book about this written by an MD.
Nope.
Cool.
Going off that same subject, yeah, you're right. I didn't. I was looking high and low for books like this, and this is the only one that I found. And then even in the research, in the medical research, there's nothing about this either. This is that new, and I really do hope and pray that this becomes more commonplace, more normal treatment, standard treatment that's done when it comes to shoulder problems, especially when you, like you said, all the probably unnecessary subacromial impingement treatments, the surgeries that are done, the decompressions. And you write in the book as well, rotator cuff tears and osteoarthritis. And you say in the book too that even if you have a rotator cuff tear, that hanging is okay for it and it won't injure it further, which I wholeheartedly believe. But I can hear somebody out there saying, I saw this video online and I bought this book and I have a torn rotator cuff. The supraspinatus is torn and this and that is torn. I'm afraid to hang. What would you say to that person, Dr. Kirsch?
Continue hanging. No, there's no harm in that. And if you read the testimonials or book reviews, you'll find that many people had subacromial impingement, which was, I've been discussing that here. Rotator cuff tears, frozen shoulder, and they cure themselves hanging. Now, I'm not going to say that the rotator cuff will heal if it's a significant tear, but you may be able to get along with rotator cuff tears and have a fairly good life, even though you cannot raise your arm the way you'd like to. I tore my rotator cuff about 10 years ago. Some dogs knocked me down and I landed on it, and I couldn't lift my arm. I couldn't lift my arm at all. Over the course of the last 10 years doing weights and exercises and hanging, I can now function, and I could play tennis with a strong serve, even with a torn rotator cuff. So
So you're still hanging yourself, I take it.
Yes. And my wife, Joy, she does too.
Oh, fantastic.
Everyone in the family hangs.
Of course, they gotta practice what you preach. Well, this is fantastic. I really appreciate you sharing your knowledge and your insight and explaining some of the things in this book here. And most importantly, I hope it serves those watching online so that they might try out this method to help their shoulder problem so that they can skip a possibly unnecessary surgery and avoid having to rely on medications and injections and get the best quality of life possible so they can get back to being healthy, active, and mobile again. So I thank you. Thank you so much for your time, Dr. Kirsch. I appreciate it.
I hope I've been informative and helpful.
You sure have.
Yeah.
So down in the description below, I've put the website for Dr. Kirsch, and let me run it on the ticker here again, just to say it out here so that you guys watching can catch it. It's www.kirschshoulder.com, KIRSCH, and then the word shoulder.com.
Yes.
You can learn more, see the videos. He's got some videos of the shoulder moving there, the acromiohumeral joint. And then, of course, get the book. It's on Amazon. It really is not a very pricey book. You know, I've seen books thinner than this for 3 times as much, to put it in perspective. And it's straightforward and easy to read. It's, even though Dr. Kirsch, orthopedic surgeon, wrote it, he wrote it in plain English. There isn't too much medical terminology in here, besides what's needed, of course. So go get that book. Go check out all the hanging bars and start fixing your shoulder. Thanks so much, Dr. Kirsch. I appreciate your time.
Okay. Thanks. Thanks, David.
Thank
Have
you.
a good night.